time again to look into the mirror of clinical changes. Aren't you excited and amazed at the improvements that may have taken place in just a few weeks? Most of you undoubtedly have sensed some of the changes of how you feel and even how you look. Some of you with depression may have felt your spirits lifted, and those struggling with overweight are probably surprised that you're able to leave behind already some pounds and kilos while eating more. And there are always some that tell us, somehow the fog has lifted. I seem to have a clearer mind. And others tell us, I now feel so much more energy. What a difference it has made. As you're progressing on your trip journey, let's take a closer look at the clinical changes.
Good morning and good afternoon to everyone. I am so pleased, and you will see an individual on the right of the screen. I am Dr. Sal. I'm the Medical Director for the Lifestyle Medicine Institute, and to my right on the screen is the founder of the CHIP program, and I will give more of an introduction in a minute. As the video clip just showed, we're going to talk about the results and what we measure in relation to the CHIP program and the effects of the program itself. And we'll get into a lot of detail. And it's really interesting to understand that modern medicine and what we do in lifestyle medicine is really to help prevent, reverse, and really help also to help treat disease. So we'll get more into the CHIP program, and Dr. Diehl will give more of his background. Obviously, he's been the founder of the program, and he'll give more information about that in a minute. But before we do that, we're going to just look at a little video clip from Dr. Avery, and then we'll come back on the other side, and I will, in a few seconds later, hand over the mic to Dr. Diehl. So we'll look at Dr. Avery next.
We'll now take a few moments to help you in understanding some of the changes you may be seeing, and just as importantly, to put them in the proper perspective. First, I want to emphasize a few critical points. Number one, the laboratory testing is a screening process and not for the purpose of making any diagnosis. Number two, you should follow up with your own doctor regarding abnormal results and for advice regarding any treatment. Third, for many of you, this is the beginning of your journey to optimal health. Each individual's body and medical makeup is different, so not everyone will progress at the same pace. Fourth, if your medicine doses have been decreased or medicines have been stopped, which of course we only recommend you do in consultation with your doctor, that may affect your results. And fifth, the benefits of the healthy lifestyle you've embarked upon are numerous, and these benefits are not just limited to the results of the measurements that we'll discuss today.
Thank you, Dr. Avery. Before I give you a little bit more information, I want to just thank our producer. This is actually the first time that we're doing the show with another individual on. So thank you, Daryl Luddington. Daryl helps us do a phenomenal job with the show. And Dr. Avery mentioned about the right perspective. Before the show and when we were rehearsing a little bit, Dr. Diehl put us in the right perspective by saying a prayer for us. And I want to really emphasize that is so important at this time in life when things are just so crazy in the world. We really have to, look to whatever we believe in as faith to really put us on the right track. So I am very pleased to be able to introduce Dr. Diehl, who most of you know as the founder of the CHIP program. Hans is a clinical professor of preventive medicine at the medical school at Loma Linda, California. And he's done just a phenomenal job over so many years emphasizing the importance of lifestyle and food and what we do on a daily basis, and telling us how we could use CHIP to better our lives. So without further ado, I will hand over the mic to Dr. Hans Diehl. Thank you, Hans, for being here.
Well, thank you, Dr. Sal. It's a real privilege and a joy for me to address our CHIP facilitators and friends and physicians that are listening in. We're recognizing more and more that we need to do our part as people, as patients. We can no longer turn over the care of these chronic diseases to a medical profession that is very limited, because if you want to really take care of these chronic diseases, you have to change the foundation, the roots, the causes. And that means how we eat, how we drink, do we get enough sleep, Do we handle our stress very well? These are these lifestyle medicine concepts that are now becoming more and more prominently pursued by the healthcare professionals. So today we wanted to talk about risk factors and how we can modify these risk factors. We do it through a very simple diet. We do it through exercise. We do it through an engagement in being in a service-oriented mode of action. What is very interesting to me is that knowing the risk factors and modifying them can motivate us that we can actually change our lifespan and our health span as well. But what are these ideal numbers for these risk factors? What should a cholesterol be like? And I want to sort of put this all on one slide initially to start us off, and that's I equals O. What in the world does that mean? Input equals output. That is to say, the more you invest yourself in these lifestyle behavior change programs, the greater the benefit will come to you. You can actually not only prevent some of these chronic diseases like heart disease and diabetes and hypertension and arthritis, you can actually arrest these diseases. You can reverse these diseases. This is the real answer. This is the solution to the chronic disease epidemic that we face today. So I equals O. The more you invest yourself into a simpler diet, into a daily exercise program, and taking care of your stressors in life, the more you can expect to see these changes producing clinical changes that we want to discuss.
Dr. Diehl, can you explain a little bit more and talk about the concepts that our medical colleagues really need to understand about the numbers, cholesterol, and all the other metrics?
Yeah, that's true. If you look at a laboratory slip where you have your cholesterol listed or your blood sugars, you have reference numbers that is given on the sheet that physicians go by. So when they look at a cholesterol result, and if it's below 200, they will tell you, everything's okay, you're doing great. I mean, you have your meats and your sausages and your eggs and your dairy, all these cholesterol-containing foods 2-3 times a day. But hey, your cholesterol is below 200, you're doing fine, because that's what the laboratory says. The reference number says anything below 200 is fine. However, as you know, Dr. Sell, when we look at international data, when we go to China, and we look at cholesterol numbers there, the normal cholesterol in China is maybe 90 or 100 or 110 or 120. In our society, we consider anything below 200, like 199, as being normal. If you have a normal American cholesterol, you're going to normally die from heart disease.
Right, exactly.
Yeah.
Well, I'll add something to that, because really what I see in the emergency rooms all the time is people leaving the emergency room after a bout of chest pain. Their heart attack was ruled out. They didn't have a heart attack. They have what we consider normal cholesterol profiles, and they still end up having a heart attack or a stroke. So obviously, as you're saying, our way of looking at cholesterol is not appropriate.
Yeah. So you take a look at the next slide, and you begin to realize that cholesterol numbers ideally in our society should be about 100 plus our age. So if you're 50 years of age, the ideal cholesterol should be probably more like 150, 160. That will protect you, and not only protect you, but it will also cause the arteries to begin to clean themselves out, and you will reversing the disease process called narrowing of the arteries. Now, there is a tendency in our society today that medical care providers oftentimes reach out for the prescription pad, which is what patients expect. And if you have a high cholesterol, let's say it's 220, which is high by our standards for sure, then we just give you a prescription drug for some statin drugs, and that will take care of everything, right?
That is the truth. Unfortunately, in the 18 years that I practiced general internal medicine. That's pretty much been my approach. And then for the last 12 years, practicing lifestyle medicine, it's a completely different approach. And really for people with, when we're trying to prevent the disease from occurring in the first place, the so-called primary prevention,
Yes.
the absolute way to approach those individuals is with lifestyle and nutrition and a whole food plant-based diet. And I can tell you the far majority of people, when they listen to the recommendations and they do what they need to do, their cholesterol comes down. You know, I'd like you to also talk in a bit about triglycerides, but their numbers come down to normal without the side effects of the medications. The statins have side effects like every other medication. They're expensive. You have to take them forever. So I think the approach with diet and exercise is right on. But maybe you could tell us a little more also about triglycerides.
Yeah, this is a very important point. Give diet a chance to lower the total cholesterol. Give diet a chance, because if you do it with medication, yes, you can lower the cholesterol with medication very effectively, actually, but it will not affect the heart disease itself. It will just make you feel good. You think you're safe, but you're not, because you haven't really changed the inside of the arteries with the pharmacologically achieved lowering of cholesterol. So here you see, when you take a drug and you try to prevent a heart attack in people that have never had a heart attack before, we call this, as you mentioned, primary prevention.
Right.
You can bring the cholesterol down 20, 30%, but you do not prevent the heart attack. They've found it takes 100 men to take these medications for 5 years at a cost of $500,000. And at the end of 5 years, in these 100 men who have never had a heart attack before, you will maybe prevent one, at the very most, 2 heart attacks. Folks, you can do that very easily with some dietary thing in just months. This is not the way to go. We need to follow a dietary approach to get the full benefit of not just lowering the cholesterol, but also opening up these arteries, because you can reverse the disease, you can widen the opening of the arteries, you can eat yourself out of angina, chest pain. I mean, you have seen this in your practice with lifestyle medicine over and over again, isn't it?
Over and over again. You know, it's really interesting. The whole concept of endothelial dysfunction, which is what you're referring to, the inside lining of the arteries becoming inflamed. And that's really what we're trying to alleviate by getting rid of all the bad foods. You know, the standard American diet, as we all know, is an inflammatory diet. So you mentioned 2 C's, chance, and what I add on is choice. And if, you know, I'm sure that a lot of people have seen the YouTube video called Make Health Last. And at the end of the video, they talk about it's your choice. What choice will you make to either lead your life in the direction of health or in the other direction of disease? So chance and choice, dealing with the inflammation in the arteries, doing it with diet and exercise. And you're right on. I mean, it happens over and over again that this is the right approach.
And, you know, you mentioned side effects with medications are always there. 20% of the patients who take these statin drugs will have side effects and they have to stop the medication.
Right.
With diet, you have only one side effect, and that's your positive changes. And you're saving money. You're reducing your food bill too. And you're feeling great. You're not just taking care of your cholesterol, you're taking care of your triglycerides, your body weight, you're taking care of your blood pressure, and you have a happier disposition. Now, you mentioned something about triglycerides, right?
Yeah, are triglycerides really a problem? I think there's some confusion about that.
Yeah, well, when it comes to triglycerides, these are blood fats. And they're usually associated with being overweight or with being a diabetic. So these triglycerides, as you see on the next slide, they sometimes are questioned. Do they really help us to reduce our heart disease risk if we lower them? Are these triglycerides helping in lowering the disease, or if they are high, do they contribute to heart disease? They've debated this for some time. We have the answer now, and that is that if you happen to have a high blood cholesterol and you add to this a high triglyceride, you compound the risk for heart disease. If your cholesterol numbers are very, very low for some reason, and you have an elevated triglycerides, the triglycerides are probably not that powerful in pushing you towards disease. Ideally, you want to keep these triglycerides below 150.
But what is really interesting, and I think in years past, when I first started practicing medicine, a lot of physicians would really almost negate the effects of a fatty liver, and we're talking about heart disease here, but when the triglycerides are high and all that fat accumulates in the liver, that's another organ that becomes dysfunctional. So we really, to look at the numbers and make sure that the numbers are normal and people are doing what they need to do, protects the heart, protects the brain, protects the liver, and that's our job as physicians, to treat the whole body.
People sometimes call me up and they say, I'm in the CHIP program. We have almost 100,000 people that have gone through the CHIP program. They call me up and they say, by the way, my triglycerides have gone up with this program. What am I doing something wrong? And I said, can you tell me what numbers have you had? Well, they went from 45 to 90.
Right.
Well, if they're staying below 150, they're perfect. If you go from 90 down to 45, they're perfect. If you go up from 30 to 110, they're perfect, as long as they stay below 150. But once they get to 200, 400, 500, 1,000, then what we see in the CHIP program, they always drop 30, 40, 50% in 3, 4, 5, 6 weeks. So high triglycerides come down very rapidly with the CHIP program. If you have very low triglycerides to start with, if they bounce around a little bit within the normal range, whether they go up or down, it's perfect.
Well, sometimes we also get questions about the HDL changing, and I think there's sometimes misconception about what is actually happening when the HDL changes. So you can elucidate on that one for us.
No, the HDL, these are the good cholesterol numbers, right? The good cholesterol. So you have good cholesterol and you have bad cholesterol. The good cholesterol is believed to bring the cholesterol out of the system back to the liver. And thus it reduces the cholesterol in the bloodstream. That's the positive aspect of HDL. However, when they come into the CHIP program, when you have a CHIP program, some of the people are very stunned. They said, I just saw my doctor, I showed him the results of the CHIP program, and the doctor said, this program is not helping you. Your HDL numbers, the HDL cholesterol should be going up, which is positive, which is good, which is helping you. But in this program, the HDL levels have gone down. This could be a dangerous program.
I can tell you, I'm embarrassed to say that some of my colleagues obviously don't understand what HDL does. And at that point, obviously, you need to re-educate the patients and explain to them, as you just did, that HDL is almost like Pac-Man. Remember the Pac-Man game? Pac-Man goes out and gobbles up, the other little creatures. So that's essentially what HDL is doing, as you mentioned, bringing LDL back to the liver. If you don't have a lot of cholesterol and LDL, you don't have a lot of bad cholesterol, you don't need a lot of HDL. I think Darren Morton periodically describes it almost like as a dump truck. The dump truck takes the bad stuff back to the garbage can, if you will. So, it's. I think we need to re-educate some of our other healthcare providers that what exactly happens with the CHIP program is exactly what's designed to happen. Yeah. Cholesterol and LDL goes down, and HDL goes down.
It is all related to the fact that when they found that people with high cholesterol numbers, when they had high HDL cholesterol numbers, the bad cholesterol that was high wasn't quite so bad. So HDL has a beneficial role to play, but only if you have very high total cholesterol numbers.
Right.
In our CHIP program, if you bring those cholesterol numbers down to, we said, 150, 160, or when you bring these LDL cholesterol numbers down, those bad cholesterol things are usually below 90, ideally. When you bring those down, you don't need the dump trucks anymore to haul it off. Right. That's a great analogy, actually, right?
Right. So really for the CHIP facilitators that are on the line, if they're not seeing these changes that we're describing in the patients and the attendees that are in their programs, it's a clue that their individuals are not following the diet properly. You really should be seeing these changes. And I know you're going to talk a little bit about about blood pressure and glucose and such. If we're not seeing those types of changes, then it's a clue that those individuals probably need some re-education, and we need to be clear, are you really doing the right thing with your diet?
Yeah, that's why I started to talk about I equals O.
Right.
You have to invest yourself. You have to be really serious about this and give your body a chance to heal itself, because that's what the body wants to do. The body is in a default position. It always wants to heal itself if you put the right raw materials into the system.
Exactly. So give us some more information, if you would, about sugar, how diabetes is involved here, and what our patients and even our facilitators should help them focus on.
Yeah, when it comes to diabetes, obviously, we should take a look at what is diabetes. And you can see on the next slide, diabetes is usually anything above 125 for your blood sugar fasting level. So if you have a blood sugar level above 125 points twice in a row after fasting for 10 hours, the chances are that you are, technically speaking, a full-blown diabetic. If you have blood sugars below 100, as you see here, 70 to 99, if your blood sugar is below 100, well, that's a normal blood sugar. That's what you really want to have. But if it's between the 100 and the 125, take a look at there. You see the middle line there? We call this borderline diabetes. And let me just pass on some new facts I just looked up the other day. There are 34 million diabetics in this country. There are also 88 million pre-diabetics. You know, there's people in between the two levels. They're out there. That means that every second, I mean, this is shocking. This means that every second American adult, is either a full-blown diabetic already or is moving towards diabetes because they already have the pre-diabetic state.
Right.
Very scary.
I think part of our job is also to bring people into the next century, if you will, to really help, especially providers, if there are any providers on the line here, to really look at other blood tests that we can talk more about in subsequent programs that give you more of an indication of the pre-diabetes, like doing insulin levels, which I do on all of my patients, C-peptide levels, A1Cs, and we can talk about that later on. But I think we need to continue that education and make people understand the importance of pre-diabetes, as you just mentioned, because the complications of someone that's a pre-diabetic are exactly the same as the complications of a full-blown diabetic.
Yes.
Yeah, it's very scary.
But how do you help diabetics to turn this disease around? I mean, we hear about this every day. I've been following my doctor's medications. I'm taking every 6 months more and more. And actually, I am afraid I'm going to be dying with these medications more than ever. Is there anything I can do to turn this disease around?
Absolutely. See, one of the concerns that I always have is the individual that goes in to see the physician, and almost, very often actually, they'll get put on insulin to lower the blood sugar, which the only thing that really accomplishes is it makes the individual heavier, and we will talk about weight. When you're heavier, you have more insulin resistance. The medications should not be the first line approach. It should be lifestyle. It should be a whole food, plant-based diet. I have gotten so many of my patients off of their medications, including insulin, when they follow a CHIP diet and a CHIP nutrition program. So that has to be our first line thought every single time. What can we do with lifestyle?
It's so easy to just take the viewpoint as a diabetic patient. If I just restrict my sugar intake, then I'm going to be okay. Is that the answer?
No, absolutely not. It's really interesting. Dr. Barnard, I think in his book, does a phenomenal job of really explaining how fat cells interfere with the function of insulin and why individuals that are diabetic on a high-fat diet do so poorly. So I think we really have to look at the pathophysiology and understand what's happening with the sugar in the diet, with the fats in the diet, and really make a difference. And that's where CHIP does so well.
Let me go one step further. since we assume that sugar is the cause of the diabetes, we also know that starch turns into sugar. So therefore, diabetic patients are usually put on a diet that is very low in sugar and very low in starch.
Right.
Now, what do we do in the CHIP program? We do just the opposite. We
Right,
tell the
exactly.
people, eat all the starch you want to eat, but
Right.
the starch has to come in its natural form. It's
Right.
not white rice, it's brown rice. It's not white flour, it's barley, it's whole wheat. Whenever you have fiber in the diet, fiber is a magical component that helps the starch to be very slowly broken down in the body, and it's handled like it's a gift from heaven. We have our patients on high starch, unrefined high starch foods that are high in fiber. They're very low in fat. You mentioned Dr. Barnard's work with the fat interfering in the cell, trying to use the blood sugar. We know now better that if we go on a program that is supposed to reverse diabetes, you need to really, really move towards a diet that is very low in fats and oils.
Right.
It's very low in animal products because they're usually high in fat. And you have to move towards a diet that is loaded with fruits. Yes, fruits are okay.
Right.
Fruits and vegetables, plenty of vegetables, lots of whole grains, unrefined grains, and never leave out those beans. Beans are magical because they're high in fiber for the diabetic. So when you do this, you have a diet of fruits, fiber-rich vegetables, whole grains, and legumes, and you keep your sugar, of course, and the oils and fats and salt down. Magically, the diabetes will reverse itself within 2 to 3 weeks. And you have to see a physician and work with your physician very, very carefully and consistently, because your physician will have to reduce the medication. Otherwise, you become hypoglycemic, which could be dangerous. So the diet is very powerful, and it's stronger than the medications that we usually offer people, and no side effects and no expenses.
Well, I have to give a plug to my friends Cyrus Kambata and Robbie Barbaro, for the people that are on the line that have not read their book on managing diabetes. And at one of the last conferences, I sat with Robbie and had lunch with him, and the guy eats a massive amount of fruit and vegetables, and people would say, how could you do that? You have type 1 diabetes. How is it that you're eating all those carbs? And he very clearly explains these are healthy carbs, which you're supposed to eat. And as you just mentioned, you need the fiber to lower your cholesterol. You need healthy carbs for your cells. So everything that these guys do, and again, these are type 1 diabetics who are on massive amounts of insulin and now have an A1C of around 5.2, which is completely normal.
Yeah.
So, there's a lot of evidence out there. Exactly what you just said is perfectly true.
So we're talking about lifestyle medicine as being the solution to this chronic disease, which is increasing every year. It's diet, simple diet, but also exercise. And I think the latest thing now is that we recommend to patients to take a walk after every meal, just 5 minutes, 10 minutes, burn off some of that sugar that is rising in your blood system. So it's diet, a very simple diet with a lot of fiber in it, and a daily exercise program.
Before we get on to questions, can you give us some information also about high blood pressure, and then we'll talk a little bit about weight?
Yeah, well, high blood pressure is one of the cardinal contributors to heart disease, aside from cholesterol and smoking, right? So we want to do something about high blood pressure, and that relates to excess weight. So if you have extra weight, begin to lose some weight. Number 2, if you're a smoker, don't smoke. Number 3, if you're on a typical American diet, that means you're taking 10 times more sodium salt than the body needs. And that causes the body to hang on to water, to dilute the salt, to make it less dangerous. And so you can gain 5, 10, 15 pounds just because of the salt, which is causing your tissues to hang on to water. So you lose weight, you do something about your salt, you get into an exercise program, and you have an excellent chance. You probably have a 40 to 60% chance of bringing your moderately high blood pressure into normal ranges, and you're no longer in need of medication. So again, here the first line of defense should be give the body a chance to heal itself. And then if it doesn't come down, or if you have very high blood pressure for different reasons, work with your physician. They'll be very happy to work with you.
Right, absolutely. That's such an important point because we see that a lot. And as you mentioned before, the hypoglycemia is an issue. As you know, that's an expected change. So you really want to be sure to work with your physician on that. The hypoglycemia could be a positive complication in the sense that we know we need to adjust medications and all. So, when you focus on really the pillars of lifestyle medicine, nutrition and physical activity, getting enough sleep, managing your stress, being mentally well, having a purpose in life and such. So all of those things, the CHIP program really is the foundation for what we're trying to accomplish with our patients. And I think the program really works so phenomenally well. For the facilitators that are on the line, I say this every time, I really implore you to get involved with the healthcare providers of your patients, of your clients, because more doctors really need to know about the program. They need to prescribe the program, and they need to see the significant benefits that come about from the CHIP program. So before we get on to the questions, Dr. Diehl, I want to really thank you. This has really been phenomenal talking with you today, and I'm sure that the people on the line feel the same way. It's great to hear from the founder of the CHIP program and what you've accomplished in so many years. So I really thank you for your leadership and for continuing to be such a champion for lifestyle medicine and for the CHIP program.
I want to thank all of these CHIP facilitators and some close to 100,000 participants in the CHIP program that have given me unending joy and fulfillment from a professional point of view. I couldn't have lived a happier life than to see people that tried everything under the sun, surgeries and procedures and pills, and yet these chronic diseases did not respond. And they come to the CHIP program, and within 3, 4, 5 weeks, everything changes.
Right. Well, we're here to serve. That's our purpose in life, and we've chosen the servant profession. So I think things are going pretty well. I'm going to look at the chat box here and see, how does the body handle fructose different from refined sugar? It really doesn't. The metabolism, it's really interesting to actually look at the physiology and what actually happens to sugars. The problem really comes in when you're getting too much sugar, and the source, I mean, you could go overboard and get too much sugar from fruits if you're eating fruits all day long. The point is really to have a major focus on eating the right amounts of whole foods. There was a study done not too long ago that showed that people that eat a piece of fruit, 1 or 2 pieces of fruit before a meal, eat about 300 calories less in the meal, and that was beneficial to their blood sugar, their blood pressure, so on and so forth. So the metabolism is pretty much the same, and we want people to really look at what they're eating as a whole foods, plant-based.
Fructose is not recommended to be used in these refined foods. But when you eat fructose as it comes in nature, like right. In strawberries, somehow nature seems to know what to do and to do it right? And particularly when you have fructose in, for instance, fruits, because in the fruit you also have certain fibers, you have certain things that are soluble fibers that cause the balancing of the fructose very, very nicely, and there's no concern about fructose as it comes in food. When it comes in processed foods, different story, because you have now actually extracted it from the food itself, and you put it into an unnatural environment. The body sometimes doesn't know what to do there.
Well, you may want to follow up that answer with the next question, where Maddie's asking about dehydrated food. Is dehydrated food good? Although I realize that dehydrated fruit can be more concentrated in sugar. Well, how do you feel about that?
Yeah, we do not recommend too much dehydrated fruit because it's high in energy energy density is high. You can eat very easily 5 apricots that are dehydrated, but you could never eat 5 real apricots as they come in nature because there's a lot of water there, a lot of chewing, right? So because of the calorie load, number one, and because also it concentrates the sugars when we use them as dehydrated fruits, that is not to your best advantage when it comes to diabetes management.
Someone asked about when normal is it better to be lower, 4.5 versus 5.5? When you get to a goal of around below 5.7, certainly 5.2, 3, 4 is completely normal. I wouldn't see that there would be any reason to try to go lower than that. Hypoglycemia, low blood sugar is not a good thing. It makes people faint. So if you're not eating an adequate amount of food and whole foods, you probably could become hypoglycemic. Again, if the CHIP program makes you improve your A1C, but you're not eating enough calories, that could be a problem. So I would never ask my patients to be any lower than about 5.2 to 5.5.
Well, I see a lot of questions here, and I see a lot of people that are making some very affirming comments. I really want to express my appreciation for Dr. Sell as the medical director of the CHIP program. I appreciate the staff that we have, and I appreciate being online with you today, Dr. Sell.
I think we're about 8 minutes over. I want to thank everyone for participating. And again, please share the link with your friends, family, patients, neighbors, people that you like, people that you don't like. Invite everyone to the program. We really want to continue to spread the word that there is a better way. When Dr. Diehl started the program talking about how right away we write prescriptions for medications, there is a better way to take care of our health. The better way is using the CHIP program and whole foods, using lifestyle medicine approaches. So please invite your friends, family, patients, and other physicians and other healthcare providers. And we will see you again next week. God bless everyone in the meantime. Stay well. Thank you, Dr. Diehl.
Thank you.